I'll call this meeting to order, and for those of you in the room, could you please lead us in a pledge?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you all. And again, this is Sean Askham. Hopefully we don't have any public audience because we obviously don't want folks coming in. Maria, do we have any comments that were emailed in or otherwise? I have not received any.
I did not receive any.
Okay. We have gotten some emails, Eric and I, and I'm sure you have, about gatherings and such, and we can talk about that later on in the agenda, but nothing specifically for this agenda. We all should have gotten a copy of the minutes from our meeting last Thursday. Folks have had a chance to review those. Before I do that, let me just make sure that we've got everybody on the phone. So I'll start in alphabetical order here. Do we have Melissa Appleby on the phone?
She's covering at another meeting for me this morning.
Good for her. Okay, excellent. Obviously, I'm here, Sean Askham. Chief Baldus?
I'm here.
Yep. Mike Berry?
Michael Berry's here.
Mike. Chief Bolter?
Yes, I'm here. Good morning.
Got Maria Capriola, our town manager. Thank you, Maria. I'm cheating. I can see you on SCTV.
Yes.
Kristen Formanak, I believe we heard you earlier.
Yep, present.
There you are. All right. Jennifer Katanis, Health District.
Yep, I'm here.
Thank you for joining us. Kevin Kowalski.
Kevin's at a fire call. He'll be on shortly.
Absolutely. That's obviously important. Mark Ritz.
Here.
Hey, Mark. Melissa Marquis.
Hi, good morning. I'm here.
Hey, good morning. Mark Massaro. Sarah Nielsen.
I'm here.
Sarah. Chris Peterson.
Present. Thank you.
Thank you. Tom Roy.
Here.
Nancy Sheets.
Here.
Morning, Nancy.
Morning.
Karen Stewart. I believe we heard you before.
Good morning. I'm here.
Hey, good morning. Neil Sullivan.
Yes, good morning.
Hey, Neil. Gary Wilcox. Gary's taking care of the last minute of senior hour there at Stop and Shop. Okay. Anyone else that I did not call that's on the phone? All right. So we'll return. Thank you. Still getting used to chairing minutes or chairing meetings on the phone here. But again, this is Sean Askham for the Board of Selectmen. We're going to go ahead and approve the minutes. We all should have received a copy of from the last meeting, again, last Thursday. Any comments, questions, objections, changes? Okay. Hearing none, those minutes will stand. All right, we'll go through obviously the topic of the year. Jennifer Katanis, Farmington Valley Health District. You're on first.
Okay, thanks. Good morning, everyone. We are 3 weeks out from our first case in Connecticut. And as you all know, a lot has changed in those 3 weeks. As of yesterday, we have 3,128 confirmed cases in the state, but we absolutely know that this is just the tip of the iceberg and a very limited representation of the total burden within our communities. In the Farmington Valley, we have, as of yesterday, 42 laboratory confirmed tests. There are significant issues with the lab testing. It is still being prioritized for hospitalized patients, hospital workers, and those that are most seriously ill. So we know that there are a lot of folks in our communities that have COVID-19 and are asked to shelter in place and do all the things to protect their family and their communities. We are about 2.5 weeks out from our restaurant closures and 1.5 weeks out from the governor's requirement that all non-essential businesses remain closed. And we really need to double up our efforts on making sure that people are adhering to the stay-at-home related activities. We anticipate, as we learn more about this virus, that CDC will be issuing and has issued changing guidance almost every single day. Some of the more significant changes in guidance this week were for return to work policies specific to healthcare workers and our first responders. We did push that out to all of our police departments. We have been fielding questions. If you haven't seen those, let me know. I imagine all of our EMS partners and others are getting that through a variety of channels as well. We need to double up our efforts. I think that our grocery stores in the Farmington Valley are really doing a tremendous job. In many respects, they were ahead of the curve in terms of some of the social distancing, protecting their staff, etc. But we need to double up our efforts with the public, that just because these grocery stores are open, it doesn't mean you go there just because you ran out of bananas. And so anything that we can do collectively to get that message out would be important. They should not be bringing kids. Even the elderly population, if they have alternatives to getting their groceries, younger, healthy family members, etc. So, you know, we can think about whether we want to have grocery stores provide, you know, material, you know, a sheet of paper describing what people need to think about before they come to the grocery store, when they check out, or something to that effect. I'll be talking to my team here to see what we can do with that. I have been communicating with our long-term care facilities. Yesterday I talked to every single one of them. Most of them are really holding their own. Most of them are in good shape with respect to PPE. It is my understanding that the state is doing some distribution of PPE to our long-term care facilities, and there may actually be a distribution today. I'm not exactly sure where. In the region, I know there are alternative care facilities being established in proximity to some of our hospitals to prepare for the surge that they anticipate in hospitalized patients. And at the state level, there are plans being developed that to address those patients, you know, nursing home surge, those patients that are well enough to not be hospitalized but need to have some level of nursing, skilled nursing care. So those plans are in the works. All of them come with their own logistical, legal, and other challenges, but that is being worked on. We are still tracking cases and contacts, and it's in large part because of that work that we truly know that the burden of illness in our communities is far greater than what the lab results suggest. So with that, I think I will stop, and I'm certainly available to answer questions.
Hey, Jennifer, it's Mark Kritz.
Hey, Mark.
Hey, do you happen to know the number of confirmed cases in Simsbury?
It's 7 as of yesterday.
Okay. Thank you. I've heard more.
Yep.
Jennifer, any guidance from your side that's changed in terms of what the town can do with respect to golf course, playgrounds, schools, et cetera? And the reason I ask that is because at least Eric and I are getting a substantial volume of emails from concerned residents as they drive by schools and other playgrounds where folks are congregating and clearly not taking the stay-at-home order seriously.
Yeah, I mean, I think at this point, if we know that that's happening in our communities, we have to shut those down. Many of our towns have.
Yeah, we have
Our-
shut
So
those
we-
down.
Our
Playgrounds in
Yeah,
particular.
the playgrounds and the basketball
Well,
courts.
hold on a sec, guys. So
sorry.
go ahead, Maria.
No, we have shut down the playgrounds and basketball courts. That's been at least over a week now. One of the measures we also took with the basketball courts was we took down the rims to ensure that, what's really hard about, most of our playgrounds and most of our basketball courts is they don't have fencing around them. So it's difficult to, shut them down. So we've posted signage saying that they're closed. And where possible, we took other measures like taking down the rims on the basketball and the basketball hoops essentially to try to keep folks from congregating there. But the golf course is still open at the moment with the various precautions and measures that have been worked out through the Golf Association.
Neil, do you want to address
with
it from
respect
the?
to the the
Sean,
school properties?
Yeah, our playgrounds have been shut down as well. We have not done the removal of basketball hoops. Quite frankly, didn't think of that, but the playgrounds were shut down last week.
Yeah. So, and I agree. We've done the part on our side. The challenge is that people are still congregating in these places, either on the soccer fields, et cetera, because as folks are looking to get out. So is there a mechanism, do we need to move to asking these folks to leave the premises? Because folks aren't supposed to be on school property right now, period, right?
I might defer to the chief on that. I don't know. I mean, it would be hard pressed for me to say you can't be on the backfield of Simsbury High right now if you're. I mean, I don't know how the stay-at-home order is. We closed down the turf field because we can lock that, but as Maria said, most of these areas can't be locked down.
But officially, they're closed, correct?
I guess, yeah.
So I'd like to talk to this group about, do we need to move to enforcement, et cetera?
Sean,
Because we simply can't have groups of 20 playing soccer and not taking this seriously.
Right, and just so you know, Sean, I just got an email from the facilities director, Andy O'Brien, saying that one of the custodians has heard that there's a soccer game now being tried to figure out on a 10 versus 10 somewhere in town. So we know it's happening. It is happening on some of our playgrounds. And I'm in discussions with Neil and with Matt on trying to figure out how we can better shut down the playgrounds, because we do not have the basketball hoops removed, and that's one thing that we're discussing on whether we should do or not.
Yeah, and again, this is not criticism to anybody. It's just this
No, right.
obviously situation is evolving.
Yeah, and I think you're right going forward with the
I mean,
enforcement part.
how are they getting there? Are they riding their bikes? Are they walking? Are they driving? Can we close down the parking lots of all the schools?
That's a little bit tougher to
Barricade
do.
them?
Jennifer, that's a little bit tougher to do with what we've currently got going on with the grab and go for meals and the Chromebooks. We still have, we're organizing times now to have teachers come back in because they have to get their third quarter grades in. And science teachers are also looking to come in to get equipment so that they can do some of their online teaching.
This is Sarah Nielsen here. We're seeing on social media, on our Facebook page, someone posted that the 10v10 is happening at Latimer Lane, if that helps.
Okay, thank you, Sarah.
It is.
Yeah, and so just to add to this, my office received a call yesterday afternoon and coordinated with our parks team, and I believe reached out to police as well. And my understanding is I think that there was going to be some coordination, perhaps, of taking down, similar to what we did with the basketball hoops, of taking down the soccer goals, perhaps, as a way to sort of deter that. And again, staff, once we got the call, went over to, to sort of just make sure that it was safe and that we didn't have large groups congregating, and if there were, they were going to break it up. So we did get a call, we did take it, we did respond to it. And again, our parks team is looking at, perhaps taking down the goals in our various soccer fields as well.
This is Jim Baldus. If I could also suggest, we probably need to do a lot more in terms of some signage at all these facilities, indicating that they are closed. And what I would also suggest is if we could, Neil, maybe through the learning process that's going on within the school systems, is getting messages out to the students directly and to the parents about this issue and the fact that we really need their cooperation in trying to avoid these kind of activities.
Yeah, we could certainly push out a communication. I do think I think a lot of this might be, let's remember that we have a whole bunch of college students back in town too.
That's true.
Again, I don't care who it is. The fact is they're on town land and they shouldn't be. So we need to be proactive in making sure that they stop.
This Jennifer, if the school wants help with some messaging, even recognizing it may be only a fraction of the kids that are there, I'd be happy to work with you on that.
Thanks, Jennifer.
That's what, we can push the messaging. I'm not worried about that.
Yep.
Tom Roy,
And I agree with Jim that I know we have signage and some caution tape for the playgrounds, but I don't know what we've done elsewhere. So I'll work with Mark on that.
Okay.
And then Chief Bolter, again, I don't want to get to this, but is there an enforcement option to be discussed at some point?
There is, and I think that this process that we're talking about right now is going to help with that. So it is sort of a tiered approach. I think there are steps that have to be taken beforehand. The state has not shut down all parks or school grounds. Once we make that determination that the school grounds are closed to the public, because on a regular basis they are not. And I know we've taken the steps to close the actual playgrounds at the schools, but the outside facility walking around the property has been sort of a normal course of business. And so once we take that step to say the property is off limits, and we get that message out there, that's very clear out there, then when people do congregate there are several steps we can take. One, either from the police, or two, even before the police, if you have custodians or staff on school grounds to be able to move them along. Otherwise, the enforcement action is there for us. But we must give people notice, because the normal daily routine or daily operating procedure is people can go on those grounds, and they can walk in the backfield at the high school on a Saturday afternoon without any issues. I am interested in who is setting up that 10v10, because my guess is it's not going to be young kids, that it could be college students home, or even there are some adult leagues. And I happened to be in a neighboring jurisdiction yesterday and saw groups of 4 or 5, playing soccer, and they were adults. So I think we need to take these steps, and I think the sooner and the more clear we are with the public, the better response we're going to get.
Appreciate that.
Nick, would it be helpful if we drafted something as a warning that officers could hand out as kind of that first step, to anybody that, kids and stuff that are congregating, before we take the step of actual enforcement, whatever that means, ticketing, et cetera?
I don't think so. We're going to do everything that we can as an alternative to ticketing or to arrests, because really the purpose is to make sure that everybody is safe. So I think if we, make that announcement, whether the school grounds are closed or are not closed for general public use, if we then take some steps to put up signage or restrictions, we then have personnel on those school grounds during some of the daytime hours I think those are the steps that are going to help us. And then if we do find people on there and those steps have been taken, then we can just say to them, you need to leave. And if you don't leave, then here are the consequences. So I'm sure everybody is aware. I mean, you have to be living really out in the middle of nowhere with no communication to know that you really shouldn't be doing these things. I think the officers are going to be really good at communicating that to groups. They're not just going to flag them out. They're going to say, you guys really need to consider what you're doing here. These are the reasons why.
Chief, I appreciate it.
Tom Roy, I guess to that point, we helped Andy O'Brien a little bit with some signage early on. If we need signage, we can help with that, but I kind of think at this point signage helps, but the people who are out there are making kind of a conscious decision right now. And I think that's the frustration that's being seen on social media.
Yeah, I think they are making that conscious decision to do that, but I think the signs will help because you may have a family of 4 that are walking through, and that may be fine. They may have sort of limited their contacts with everybody, and it's just a family of 4, and they're really not increasing their chances unless they're around other people, and people start to see that, and they may be assuming that it's okay to congregate, or they're not taking into consideration that's a family unit that's been in their house all day long, and they're not really interacting with others. I think that signage is key right now.
Yeah, sir, I agree with you on that. I think what we have to do is, there are signs out there right now, but they're very small, and you have to be almost right up on top of it to be able to see the sign. It's more like a page, a 8.5 by 11 sheet. I think what we need to do is go to more something along the line of a metal sign saying warning, facilities closed, and put that out at the roadside so people coming in will see that when they enter the property.
I agree.
Sounds good.
With that, so are we saying we're closing the facilities, or are we closing the facilities to groups, or I just want to make sure that we're clear on our messaging.
That to me is, I think we're closing the playgrounds and any organized activities. But, I mean, for you to try to say that the number of people at Central School who walk their dogs in that neighborhood, and, I mean, you're going to be chasing something that's impossible to enforce. I mean, to me, it's the organized gatherings on the playgrounds. That's what we want to be able to stop.
Agreed.
So,
and I think we have an obligation to proactively stop it.
Yeah. So certainly we can work on the messaging, and then Mark and Tom and I can try to figure out exactly what signage should say.
Sounds like a plan.
Yeah, and again, I think this is Maria, and again, similar to what we ended up doing with the basketball courts, on taking down the rims, I think, continuing to have, park staff and working with school staff to remove the goalpost. Again, since we now know that that's another way that people are congregating, we can remove that to help deter some of that. So I'll make sure that we continue to follow through on that today.
Appreciate it.
Welcome.
All right. Anything else for Jennifer? No. Okay. Can obviously come back. All right, Maria, the floor is yours.
Great, thank you. So I really would just like to commend our team during this really challenging time. They have just stepped up, the leadership team, our staff, our municipal officials, our public safety partners. Everybody has just been working so hard for our community. I'm really proud of the work that everybody has been doing, and just wanted to lead off with that. All of our town buildings are now closed to the public. We're going into week 2 of that mode of operation. We do have staff on a very limited basis checking in to our various departments physically in our buildings daily. Unfortunately, there are certain tasks that departments have that there's really no other way to do it other than sort of a manual process. But again, we have very much skeleton crews coming in at times staggered to take care of those tasks. We have staff still who are available by phone, by email, our online services. We're really encouraging people to do that. If it's an emergency or urgent situation, again, staff has the discretion on a case-by-case basis as to whether or not that they will help an individual in person. One of the things that has been keeping us really busy for the last few weeks is a number of the executive orders that have come out from the governor do have an impact on our municipal operations. So sometimes that evolves and changes daily. So we've been spending a considerable amount of time with that. I did get an inquiry from a member of the public yesterday through an email. And I'll be responding back to that person today. But essentially looking for me as the municipal CEO to take more restrictive measures than what the governor has put in place. And he did issue an executive order fairly recently, I'd say within about the last week or so, where he said that municipal CEOs can no longer do that. So he wanted a consistent, sort of approach in response to this, and that if a municipal CEO had enacted more restrictive measures prior to that executive order, they could remain in place. But for example, a resident had inquired about a curfew, and could I insist on a curfew? And at this point in time, that's not something I would be able to do. So I thought that would be helpful to share today in case others had that question. I was planning to talk about our parks, so Sean, thank you. That was a really good segue. Just as a reminder, again, our basketball courts, our playgrounds, our tennis courts, those are now closed. Our parks, our open space parcels, and our trails are still open for passive recreation, and I think that's the key distinction here, is that, again, if people are using our trails, if they're walking through our open space parcels, if they're using social distancing and keeping a safe distance from other patrons, that is still, we are still welcoming people in our parks and open space for that purpose. Let's see what else. Our meetings are still closed to the public. That executive order is in place through at least April 22nd. There is the possibility that that may be extended. So right now, most of our advisory committees are not meeting. We do have a number of regulatory bodies who do need to meet to conduct certain business. So we have a limited number of public meetings that are happening at this point in time. We are airing those live with SCTV's help. So people can watch those meetings live over the television or online. And since the meetings are close to the public, I did just want to throw this out here again in terms of the email address. People are welcome to submit comments in writing to us. Our town clerk's office is collecting those comments for us and getting them to the chairs of our various committees that are meeting still. And that email address is ebutler@simsbury-ct.gov. We're also encouraging folks to sign up for our email updates. They can do that by going to the town's official homepage. It's called our news and announcements. They're essentially email blasts. So when we have something that's of really a high level of importance, we are sending information out through that channel. We are also sending information out through our social media accounts. So again, would really encourage folks to like our Facebook page, to follow our Twitter account. Again, we're really trying to keep that up to date with current information that we think would be helpful to our residents as well as our business community. And I think that's it for me right now, unless there are questions.
Maria, with respect to the municipal CEOs, do the same rules apply to the legislative bodies of the communities?
I would say so, yeah. And I can double check with Bob on that, but I would say that's pretty consistent. The messaging was just that, he didn't want municipalities taking more restrictive, measures than what he was putting in place, that he wanted a consistent message, a consistent approach. But I'll confirm that with Bob.
And not to rock the boat, but he has the authority to tell us we can't pass our own legislation?
Yeah, I'll check with Bob about that. For example, one of the, again, concrete sort of examples a resident asked about yesterday was a curfew. So, and at this point in time,
I just want to make sure, because same fight as the president and governors, et cetera. Who can tell who what to do? Right. Just want to make sure it's clear. I'm not looking to do anything, right, but I'd rather know what we can and can't do ahead of time.
I'll double check with Bob.
You know me, I'm not exactly good on taking orders from people at the state.
I'll check with Bob.
All right. All right. Any more questions for Maria? All right. Mike Berry, Emergency Management.
Good morning, everybody.
Morning, Mike.
Again, there's really not that much to say at this point. There's been a lot of promises by the state that there'll be equipment coming to assist us. We have all of our requests in. We've had our requests in for over a week. And again, we've had a lot of promises made to us, but nothing has been delivered. So we are constantly on the search for PPE to try to help us out, to try to make sure that we are prepared. We do have a small supply, so we are ready for a small surge when it comes. We're definitely not prepared for a large surge, but we are definitely going to be able to hold our own for a little while, and hopefully that'll be enough until we can get backup from the state. I am continuing to be in contact with regional and state officials, keeping track of what's going on. I am keeping track of Web EOC and putting our updates on there. We are also pumping information out to the residents through WSIM. So any way we can get people to tune us in every once in a while. We do have spots about the restaurants that are open for available for takeout, and also for grocery stores and things that are available for people to get the necessary supplies that they need. As I said yesterday, I forgot to put the little spot on there for Neckers to make sure that people that have kids have a place to go to get new puzzles and games to try to keep them occupied in this trying time. And I know it's going to be difficult for parents with small kids. So we're kind of holding our own right now. We're waiting for things to really kind of take off. We're keeping in touch with our long-term care facilities and what's going on with them. So basically, we're just in a holding pattern and kind of holding our own right now.
Appreciate that. And Mike, can you just clarify for folks? We've gotten some questions on why we haven't opened the EOC. We just have the web EOC open. That we're not. The town is fully responding to this.
Sean, this is Kevin. I could probably answer that too.
Okay, Kevin. Hey, sorry. Thanks for joining us.
Yeah, sorry, I was on a call. So.
No, understood. Yep, understood.
The EOC is operational when we have things to do. Quite frankly,
right.
We are managing all the administrative tasks through Michael through the web EOC. What that does is that keeps everyone in the state on notice of what Simsbury is doing, and that's the purpose of it. We also send in requests as needed, as Mike alluded to some of our PPE requirements, and also some of the operations that we've done, the emergency declaration, et cetera. So that's all done administratively. When we get into a situation where we have decisions that have to be made immediately for the purposes of emergency response, that's when we'll get the band together and go to the EOC to open. At this point in time, we're not to that point, and quite frankly, we would just burn out our folks for no reason, just sitting in a room. So that's the reason why we're not doing that right now.
And I appreciate that, Kevin. I just wanted to make sure that folks that have seen us respond to disasters and such in the past, this is obviously the appropriate response for this one. It's different every time, right?
Oh, it absolutely is. In this particular case, as Mike alluded to, we're really just in a standby mode right now because we haven't gotten a surge. We don't even know if we'll open EOC during a surge or how we're going to react to it. We'll make that decision as we go on. But again, our resources are limited, so we don't want to use them all up for just a standby purpose.
Exactly. And folks should rest assured, part of the reason why we're keeping this group together weekly on this call is to continue to collaborate, discuss, and obviously you guys are discussing offline as needed. So the town's in good hands right now.
Yeah, I mean, just to reaffirm that, and Maria, I'm sure, mentioned it, I mean, we have daily conference calls that take up a substantial portion of time discussing with all different stakeholders in this. And that's the important fact that all the community, all the public safety groups, they're all communicating offline to make sure that we have the best response based on the information that we're getting on that particular day. And quite frankly, all the information is changing daily. So that's what we're working with, and that's the best we can do.
I appreciate the efforts. I know that's it's a lot for everybody, but thank you. Kevin, you want to add anything else from the emergency management side?
No, Mike said it well. Like I said, we're just on a standby position, and we're just fielding all the requirements and responses that we need to do to make sure that Maria is supported in her tasks, to make sure that if we need to substantiate any information for her report writing and her submissions, we're there for her. So that's pretty much what we're doing right now. The WSIM radio system is working. We have now 4 additional people that are on the air getting information out. If anyone wants to do any on-air work, if you want to talk on the radio, explain people better, we are multiplying our listening group by hundreds every day. So it's pretty interesting how that's working out.
Excellent. Appreciate you guys running that as well. That was good foresight years ago to get that. All right. Questions for Kevin or Mike? All right. Chief Bolter.
Okay. So with our lobby being closed, we think most people have honored that, and we have very few people coming in and out of the lobby of the police department. Our staffing levels right now are doing very well. We have looked at scheduling options that we have to limit exposures and the amount of people working at one particular time. We have a bunch of options that we can look to if we need to. But right now, our staffing levels are good. Our call volumes, again, are very low, which is good. Our equipment needs are satisfactory right now. We did receive a supply from the state, and I hope this does not sound too cynical, but we drove to Windsor to collect 1 box of medical gloves and I think 30 face masks. So that was the extent of the distribution from the state at this point to us. We are receiving donations from a bunch of businesses and individuals. We have received medical gloves, we've received some surgical masks, and we'll continue to accept those. We've received some N95 masks as well. We are receiving the notifications from the Farmington Valley Health District on the confirmed addresses in town and have been putting those in our CAD system. It's an alert, so whenever a first responder goes to a particular address, they are aware that a person at that residence has been confirmed. So that is going well. I'll reiterate what everybody else is saying. The communication between all the parties here has been unbelievable. So I appreciate all that. And just to comment on some of the face masks and face shields that people are creating at home. We've had a generous amount of offers for this, and up to this point we've been very hesitant to accept any, because in order for our officers to wear masks, they have to be NIOSH approved. There's regulations on these. But the push is so significant right now that we will be accepting these and we will hold them for potential other uses. So we really appreciate that. And then one in particular, the library created an N95 sort of similar mask that you could see online that a bunch of people are doing with their 3D printer. And again, the generosity and the benevolence is unbelievable. But we're just not able to use those at this point, but really certainly appreciate everything that everybody is doing. Our officers have been going to calls where people are suspected of having COVID-19 or houses where people have been confirmed after the fact. And they are doing a great job in protecting themselves and providing the necessary care for the patients. I'd like to continue sort of our conversation about how we can limit the amount of people at some of our places, and we can definitely do that offline with the school, highway, and Maria's office.
Chief, appreciate all that. Thank you.
Sean, can I jump in quickly?
Go ahead, Maria.
Thank you so much. Something that the chief brought up, and I haven't had too many inquiries from the public about this, but while we've also got Jennifer on the phone, perhaps we could address this. So I've received a small number of email inquiries from residents who would like some fairly specific details about individuals who have come down with the cases and wanting to know, again, details, sort of the who, the where. And again, at this point, our public safety professionals, we have the addresses, not individual names. And again, that is just to ensure that our public safety professionals and any of our staff members who may have a need to go inside that home and respond to help an individual, that they have the ability to, exert caution to protect themselves, but that we are not providing private protected health information of individuals to the general public. Again, we've only received a small number of those inquiries, but I thought it was worthwhile just to mention that we are not, releasing private protected health information of individuals.
Yeah, I'd like to comment on that because, I have received those inquiries as well. A couple things. One, we as a local health department are required to comply with Connecticut General Statute 19A25, which speaks specifically to confidentiality of health data. Two, the commissioner has provided us very specific guidelines with respect to clarification under this emergency, what can be disclosed and to whom. And that specifically speaks to addresses to our first responders and specifically articulates the fact that we are not to release personally identified data to anyone else. Third, and most importantly, it does not change the public health message in any way, shape, or form. The bottom line is laboratory test results only represent the tip of the iceberg. The activities and initiatives that the general public needs to take to protect themselves do not change if they know that a neighbor has it, if a mail carrier has it, or a police officer has it. So those are my three speaking points. I will not be disclosing individual level data or even data that could be used. We have a lot of small towns with only a very few cases, and if you get much past gender and age, some people have asked for occupation and other things, that could be actually deemed as personally identifiable data. So these are the laws under which I am operating, the commissioner's directives under which I'm operating, and most importantly, it doesn't change the message and the public health actions that people need to take. Thank you for asking the question.
Thank you.
Thank you, Jennifer. That's really important. And again, nobody in this group wants to disclose any of that, but for the folks at home that are listening, they understand your message loud and clear. So thank you for reiterating that. Appreciate it.
Can I ask a question regarding the, I've been thinking a lot about the hand-sewn face masks as well. And, we may see some changes in CDC guidance, they've been holding steady that the general public does not need to be wearing face masks. These homemade sewn masks may serve a purpose, for instance, in our grocery stores, if there were a mechanism to hand them out to residents who are grocery shopping to keep and use in that situation. I'm just, I know that it's emerging. I know that people are sewing them like crazy, but that might be a more appropriate use of some of these masks so that we can preserve the surgical masks and the N95s and things for our healthcare and first responder populations. So I think we need to think about that a little bit.
Great. Yeah, Jennifer, this is Nick, and that was my thought on if people are offering those up and they don't have a place to give those, if they don't have a group of people that are accepting them, that's where we may then just start accepting them at this point. So if we do get to that point, then we have a supply and we can potentially move forward with that idea.
Yeah, Sean, if I may add to that, this is Kevin. One of the issues that I'm seeing coming forward now, and my concern is with the shortage of all the face masks that we're as first responders and the medical industry is finding. And then now having California come out with a general notice to say, y'all need to wear these things, it's going to suck all the face masks out of the system that we're trying to get to the areas. So the use of these sewn face masks for the regular public would probably be ideal.
Okay.
This is Kristen. If I can just make a comment, the senior center, is also serving as a collection spot for the face masks. And while we don't have anyone to redistribute them to at this point, that was kind of our thought moving forward, is that we would save them for the event that we need them for the general population, or even to be able to make them available to our seniors who might feel more comfortable wearing one if they're out in the public.
Okay. So Maria, perhaps we circle back offline on that one in terms of how do we centralize, collect, and maybe work with Sarah and others on connecting with the business community. I love Jennifer's idea of the grocery stores.
That'd be great. That would be great.
Okay. All right, great discussion. Ambulance, Karen.
Yes, good morning, everybody. I'd like to reiterate the chief's comment about the state supply. I also drove to Windsor yesterday to get a box of extra small gloves and one canister of cabbie wipes. So that was the extent of what their contribution was to the ambulance yesterday, although I was told that tomorrow, supposedly, there might be another opportunity to pick up some more supplies. We'll see if that happens. So we're still trying to collect everything we can, stockpiling as much as we can. I've gotten donations from the residents who have gone in their basement and found N95 masks or canisters of Clorox wipes, whatever they seem to find, they're dropping it off, which is greatly appreciated. Our call volume is still, been very low, but which is good. Our staffing still remains very strong, but if there's an increase in exposure calls, we're at risk of having to put our staff in quarantine, which is my concern, obviously, at this point. I've been proactive and have put in a place backup plan with the staffing plan with the fire department and our mutual aid towns, and that hopefully we'll never have to use that, but it's there and ready to go if we do. We've had a few crews that have been exposed to COVID-19 with positive patients. They're all being monitored at this point. Unfortunately, they all adhere to our strict PPE policy, so the risk was very low. In constant contact with our mutual aid towns, and we're always touching base to see if they're getting low on supplies or staffing, so we all have a game plan in place in case something does, the other shoe should drop, which is what I think everybody's saying. We're just kind of in limbo waiting to see what's going to happen if we have this surge. The latest thing we put together is a system for disinfecting the ambulance, which entails basically, using a paint sprayer and a mixture of 27% hydrogen peroxide and water, which we actually can spray inside the back of the ambulance, and it dries after about 5 or 6 minutes. This is in addition to our usual cleaning of the ambulance, but allows for some disinfecting into the crevices and around corners that we can't always reach with our hands, which has been pretty effective and a very useful thing to have. One thing I'm seeing on the horizon is the possibility of changing our protocols, which, if our med control approves, which may allow us to strongly recommend that patients who call 911 and do not exhibit COVID-19 symptoms or any life-threatening issues to stay at home or to contact their physician. Right now, we can't refuse to transport a patient. If they want to go to the hospital, we have to take them. But if this gets into place, we might be able to strongly encourage them to, one, not leave their home, two, that maybe it'd be better just to talk to their doctor, and to just impress upon them that this would be a more wise choice, so to say, so it doesn't back up the hospital with patients that don't need to be in the emergency room. So that's pretty much our update, and like I said, we're just waiting for that other shoe to drop if it does, and been talking with the police and with fire and coordinating our efforts, and I think we're ready for it, so to speak. So, and that's all I have. Anybody has any questions?
Karen, appreciate that. Any questions? All right, Chief Baldus, fire.
Yes, good morning. As with everybody else reporting, we're in good shape as far as staffing wise. Our volunteers are staying healthy. We're in touch with them on a regular basis to ensure that they're also continuing to do the social distancing. And as has been mentioned by many of the other agencies here, the cooperation and communication has been second to none. It's been very, very helpful in terms of making sure that everybody is staying informed. but also that we have our plans in place. As Karen mentioned, we've been working very closely with them, as we have a number of our volunteers who are also medically trained and can assist in the ambulance responses if, in fact, we get to that point. So we are doing everything we can as well to secure additional resources through Mike and Kevin and Karen and others, and we appreciate everybody's efforts in that regard. Just so everybody is aware, we continue to maintain our level of response. We are not conducting our normal drills and so forth. However, we've actually established an online training program for our membership so we can continue to stay ready with certain techniques. So we are holding drills, but it's all virtual now, where everybody's basically at home on their computer, doing discussion work, doing online PowerPoints and videos and so forth, so we can continue to stay ready for the needs of the community. The other thing I'd like to mention here as well is that, with a lot of people being home, there's certainly a lot more activity going on at home. We've seen a little bit more of an uptick in some open burning. We have to remember that our residents are not allowed to open burn in this community. And we certainly, encourage the cleanup process, but we have to remember that we cannot be burning your debris in your backyards or whatever, that's still not allowed. So just please be very, very careful out there.
Thank you, Chief. Good reminder. There's a lot of lawn care going on right now, I think. So.
And just as a note on that, Sean, there is, I believe the transfer station is still open on Wednesdays and Saturdays, so they can bring their debris to the transfer station.
Yeah, Maria, is there any update on the transfer station?
Yeah.
I believe there was conversations going on.
Yes, thank you. Yeah. So myself and Tom Roy and our transfer station operator have been in discussions to temporarily close that facility. So we are sort of working through that at the moment, but I do anticipate that we will have a temporary closure of that facility except for emergency situations. There will be other ways for people to still have their bulk items collected if they have a need for that, but we're again sort of working through that at the moment, but I do expect that the station, transfer station will be closed temporarily in the very near future.
Okay.
Again, if that happens, if you maybe we could sit down and talk about alternatives, because that's going to create a problem with the open burning issues. So we could just kind of chat about that offline.
Yep.
Yeah, Kevin, this is Tom Roy. I think it may make sense to definitely talk about it offline. I think one of the things just to keep in mind is we were definitely concerned about the safety of the operation out there, and it's essentially an all-cash operation, and it just seemed that it was one more place for people to come into close contact and didn't represent the social distancing that we're really trying to encourage.
Yep, I have no problem with that. I just want to have an alternative here to come up with a plan of some sort.
And if I could just echo, this is Sarah. If we could find out a safe way to continue to allow, again, alternatives, because you're going to have a ton of residents who are home, who are doing their cleaning, who are doing their organizing, in the downtime. And we've seen on social media that there really is a need for a place, because Paynes and others are not doing any collection of items outside of the cans. That we will get a ton of phone calls, both at the state, town level and department level on that issue.
Yeah, perhaps there could be a situation where I understand the transaction is a problem as far as paying people and also people lined up, et cetera. But there may be a way we can do it, so maybe we can come up with a plan.
Appreciate that. All good points. All right, Neil, we talked about the Board of Ed a little bit before, but anything else you wanted to discuss?
Well, we're certainly doing a lot of problem solving right now with our distance learning and other parts of the operation. Not a lot of it falls into the realm of public safety. I will say that the grab and go for the lunches and breakfast seems to have leveled off. The last two times we had 80 kids who came through Again, we're running that on Monday and Wednesday mornings. So, and they get a breakfast and a lunch for each day. So, while it doesn't sound like much on Monday for Monday and Tuesday, that's actually 320 meals. And then on Wednesday, Thursday, and Friday, it was 480 meals that are picked up. So but that seems to be where it has stabilized, at least for now. And in addition to that, I mentioned we have had people coming through for various pieces of technology that they need to make things work. I did, while I was listening to the rest of the call, I just shot off a quick version of a sign that we might want to do. So if Mark Kritz and Chief Bolter and Tom Roy could take a look at that, maybe that's something we can jump on right away. I did want to note that we will be in session, if you will, next week, but we are honoring the April vacation week, so that's important to know that that week of April 13th, I guess it is, that we are on school vacation that week. And then lastly, I know we had mostly exhausted the PPE that we were able to locate. I know Mark got a couple more boxes, and let him talk about where that is.
Okay, so yesterday I delivered a couple of boxes of N95 masks over to the fire department. We're tapped out as masks go as for the N95s. The only other thing I was able to come up with is we do have some surgical masks. I have about 4 boxes of those. I still have to pick up from a couple of the other elementary schools to see what we have left, but the bulk that we have right now is mostly in gloves, and that's powder-free latex gloves, which I know a lot of the agencies out there really aren't going to be using. So I know I've given a bunch of that stuff to the VNA. I don't know whether or not, Nancy, if you want to take what I have, or if there are other agencies that might want that. So somebody can speak up and let me know that I can get some of that stuff out.
Morning, this is Nancy. You know what? You have been real generous to us, and we're receiving donations from others for the gloves that we need. So honestly, at this point, I think you should go ahead, and if somebody else has a need, I appreciate you reaching out to us, but we're good for now on gloves, that's for certain.
Okay, thanks, Nancy.
Thanks.
Hey, Mark, this is Nick. We are all set with those gloves anyways, and as you know, we can't really use those.
Correct.
But the surgical masks, if you don't find a home for those, we definitely will, because we have been using those for patients to put on the patients. So we could definitely use those if you don't find another pressing need for those.
Okay, sounds good, sir.
Thank you.
Yeah, Mark, this is Karen from Yamis. We could use them as well for patients, so we can split them up between ourselves and the police department. That would be great.
Okay, no problem, Karen. I'll get 2 boxes over to you guys and 2 boxes over to the PD.
That's perfect.
Yeah, Mark, you can give all those to the ambulance right now, because they're going on 100% of the calls, and we're not going on all that many of those. We're going on the true life-threatening ones that we have to, that we need to go on. So I would say they're probably best suited to be with the ambulance right now.
Okay, will do.
Great, thanks, and we're happy to share, Chief, if you need them later on. So.
Yep, thank you.
Thank you, guys. Appreciate that. Anything else from the Board of Ed side?
Hey,
Public Works?
Sean, Chris
Chris
Peterson. Just a quick question, Neil. Can you just confirm, I just want to hear what you said, that as far as relative to April vacation, that there will not be distance learning? You guys are actually taking a week off already from educating?
Correct. The April vacation is staying intact, and consistent with what other communities are doing. So.
Okay. Thank you for that notice.
That was all part of what the commissioner's waiver of the 180 days was. So seeking that people maintained the planned days off that they had, and still, I mean, we're still going to end on June 15th as well, which is what the recommendation from the Commissioner of Education was. So it's exactly.
I certainly hope that in the future that doesn't backfire on us, and somehow have people consider traveling or doing something during that week other than staying right at home. So that would be a bit of a concern to me, sort of lack of foresight on that. So just my personal thought, but thank you for just confirming that school is off that week, essentially.
Yep.
Neil, if I could add one thing. It's Mark.
Yeah.
Hey, just to let everybody know that along with that week of being off from school, there is discussion that we are still going to do the grab-and-go lunches and breakfasts. That was talked about yesterday with Sue Lemke. So I think that will be something that will be continuing over that week of vacation.
Appreciate that, Mark. Thank you. All right, Mr. Roy, Public Works.
Hi, all. I guess from our end, we're just trying to work on continuing our support of the rest of the operations. We are keeping up with our disinfection protocols in the police station and in the town buildings. We're actually working on getting disinfection, which the police officers could carry on their person or have in each cruiser, just so they'll have some additional resources. We've been working to help social services in supporting the food program and the signage. Hopefully we can get something going on that. And really, we're just kind of here to help out in any way we can.
Appreciate that, Tom. Anything else? Questions?
I'm good.
Appreciate it, bud. Social Services, Kristen.
Hi, good morning again. We have continued to stay busy as well. As you already heard, we're going with our food distribution on Wednesdays for our seniors. We've been working with McLean, and they're packing up the lunches and we've been doing about between 25 and 35, and that's going very well. We're also still making food available to our clients who are experiencing food insecurity, as well as gift cards. We're doing a lot of pushing of information out through the website and through Facebook, and trying to make sure that people have information and access to the resources that they need. I've already gotten an increase in phone calls with folks asking about financial assistance because they've been laid off. And we are also this week communicating with our folks about renter's rebate. That's one of our bigger programs, and there's going to potentially be a delay in our starting that. So we've sent out a mailing to everyone, and we'll also be posting information about that on our website. Staff has been pretty busy returning phone calls to our seniors, our clients, our residents, and just trying to help in any way that we can.
Appreciate that work.
You're welcome. I don't know if I missed anything or if anybody has any questions.
All right, Nancy, VNA.
I just want to start by thanking a number of the players around the table, so to speak. Ambulance, fire, system all reached out to us in the last week and have assisted us in terms of getting more of the protective equipment. I really couldn't do it without your help. We've received a ton of support from community players and businesses. So I'm actually beginning to feel like we might be able to handle appropriately the onslaught of patients that I assume at some point we're going to receive. I have a number of the cloth masks just to share with you, and our use of them in the clinical world, which has been widely kind of shared amongst all of my partners, is that because the face masks, surgical masks, and N95 masks are limited, and we're in a practice now of having to actually reuse them, the cloth mask goes over the other for us so that it helps preserve the length of stay, per se, that we can use those other masks. So for all those people out there that might have to be in contact with people, have a surgical mask or an N95, and you want to try to help make it last longer, the cloth mask, and there are certainly procedures for putting it on, and when you take it off, what you do with it, how you fold it, I'd be happy to share that with people offline. But that's how we're using those, and we've been really fortunate that a number of people in the community have made some really good ones for us that we could even put filters in to make them more effective. They really are only effective for splashes and sprays and bacteria, but not for the COVID virus. But they are going to help us utilize and keep our N95s longer than we normally would. We will certainly help with getting a more serious message out there, because I am concerned, just like all of you, that right now I drive around to the various small things that I have to do in public, and I see a lot of people together. And I know this is really hard, because it's hard not to at least see kids playing with each other, but it makes me really concerned that people sort of get this but sort of don't. So we'll post some of that messaging as well. Just to let you know, too, we certainly are available. I have community nurses that if you guys need any assistance, they're off. They're not working right now. They would be happy to do some of the shopping for seniors or do some of those deliveries. So, and we do have the right equipment, so they really could get out there, get stuff, and get to other people safely. And on a personal note, I just want to share that if you close the dump, my husband may commit harry-carry. I do understand, and I think if we can come up with another process for the money exchanging, maybe we'll have a way to think about that. But that's just a small, meant-to-be comical thought.
That's fair, Nancy. Thank you. And appreciate all the work and the offers to help there. Any questions for Nancy? Sarah, you've been very patient. Appreciate it.
So I'm going to be very quick. I just want to let you know that we put out to all of our stores the new state of Connecticut safe store rules. The safe store rules go in effect tomorrow, April 3rd. And so a lot of our stores, as Jennifer mentioned, are already putting great practices in place. But, this goes through a list of general and, occupancy capping, all the way to general communication, discontinuing of self-serve foods like salad bars and product sampling, touchless credit card transactions, et cetera. So that went out to all of our businesses, to remind them to go over the checklist and make sure they're in compliance. As Nancy mentioned, the business community is stepping up. We've had Metro Beast and Harvest Cafe and Millwrights and Popovers all doing donations to our first responders, to our healthcare workers. We've had Weldon Hardware and others doing donations to, gloves and whatever, where they get them. And so the business community, even though they're hurting, is really stepping up to support our first responders. And I think that's it for now on my list. Just a reminder that Main Street has compiled and continues to update the list of restaurants and their services available, and also the list of essential businesses that are open, businesses that are on a modified open, and businesses that are closed, so that people aren't making undue trips and that they have other options besides going, into the stores where possible. And I'll share with you anecdotally, Fitzgerald's delivery, he went from maybe 8 a day maximum. He's over 100 a day right now. He's trying to service people within the same day. A lot of times, curbside pickup is also really increased. So some people are getting the message that, to make sure they're being as safe as possible. And again, for the public that may be listening, they also have, through the First Church of Christ, the Compassionate Response Team. The Compassionate Response Team will handle a variety of issues, but also does grocery delivery in partnership with Fitzgerald.
Sarah, I really appreciate that, and it's obviously important to take care of the people, but also the businesses, because the economy needs to keep running. So thank you for all you and Main Street have done to keep the information flowing.
Hey, Sean, can I just add to that? Thanks.
Of course.
I was remiss at not thanking Sarah. Because of Sarah last week, she kind of reached out to several businesses, and because they came to her to say who needs something, and she mentioned us. And honestly, I can't thank enough what she's done for us, and how she's kind of connected us to some of the local players. It really has been a tremendous support.
Appreciate that. It's one of the things I'm most proud about this group and this community is that everybody steps up and helps each other. So, all right. Do we have additional updates, questions, topics, thoughts, concerns for the good of the order this morning?
Yeah, I just have a quick question with the group, if I can. This is Kevin.
Of course.
We can certainly set up a kind of a shipping and receiving operation here. We have the room to do it for supplies. And, so as the supplies start trickling in, and I am anticipating, quite frankly, hoping that we're going to be getting more supplies that we can absolutely ever use, we have the facilities to store them in a safe, dry place right now and then distribute it. We can post a list of what we have and have people come and get them as they need them in the future. So that offer is being made out there, and I'm sure, Jim, you can confer with that here at the firehouse. And we can post this inventory through the web EOC, et cetera, and also within our group to make sure everybody has what they need when the time comes. The other item is, Jim, I don't know if you mentioned or not, but the Easter parade, if you want to make mention of that.
Sure, Kevin. The Ladies Auxiliary, in an attempt to basically, keep some sense of saneness, if you will, and joy in the community, has established a Easter Bunny run with the fire truck for Sunday, which is going to be live broadcasted on Twitter. And the information is available out there now on Facebook. If you go to the Simsbury Volunteer Fire Company's Facebook page or the Twitter page, you can get information about what streets that the Easter Bunny and our fire truck will be doing on a route. Sunday, I believe, starts at 10 o'clock in the morning. They will not be stopping. There's not going to be any kind of direct interaction with the residents and the Easter Bunny. However, we do think it'll be a nice treat for the youngsters in the community, and we certainly appreciate what the Ladies Auxiliary is doing to try to bring a little bit of a smile to the community during this time.
Yeah, that's a great point, and Chief, appreciate that. Having a 4-year-old, that's something that we can point to and look forward to. So I think you're going to get a pretty overwhelming response to that. So thank you for thinking about the kids in the community. And I believe there's over 100 streets you folks are going to visit, so a substantial portion of this town.
Yes.
Thank you for that. All right. Anything else for this morning? All right, we'll plan on. Yes.
It's Sarah. Just a reminder, as the schools and everyone was talking about April vacation, I think that we are going to see an uptick in potential issues, and it might be something we want to talk about for the next meeting, because I think you're going to see a lot more people out and about and children in grocery stores and things that we don't want. And so is there a way to get some messaging out ahead of that?
It's an excellent point. I think we need to work on that over the coming week here.
Yep.
So to that end, let's plan on same time, same place next week, Maria.
Yeah,
Does that work for everybody?
Absolutely. Yeah, absolutely.
And I think, again, I know these might feel like a redundant meeting for some of you folks, but the feedback from the community has been pretty strong in terms of these folks are listening in. They are passing it along and do really appreciate hearing from all of you leaders with your various departments and groups of what's going on out there. And I know it's been important for folks to hear that and to feel safe as they know things are under control and you guys are leading our community. So thank you. All right. So with that, I appreciate everything everyone's doing. Thank you. Stay safe out there. And we are adjourned.
Thank you.
Bye.
Bye.
Thanks, everyone.